Hello friends, this is Dr. Bhavdeep Ahuja here. I hope you are liking my videos on my YouTube channel. Today's topic for my short video is, do we really need to force the treatment plan to the patient? If the patient can afford the treatment plan, do we need to, and chooses a lesser option, do we need to stick to it? For example, if the patient can afford it and has a missing tooth, and the affordability is never an issue for him, and he chooses a RPD out of an implant or a bridge, so what do we need to do in such a situation? Do we really need to act, react, or explain what to do? So let us see in this video today. So if the patient has a missing tooth, and your options of course will start from an implant, considering all the situations in the patient's mouth are normal, the periodontium, the adjoining teeth, and the associated tooth structure. So if the things are normal, let's talk in that scenario, and you advise an implant. The patient says, okay, I can't afford an implant, let's go in for crown and bridge. So yes, that is still a viable option considering the economics of majority of the middle class. Again, it depends upon what target group of population do you have in your clinic walking in. The problem comes that when the patient has a similar situation, a missing tooth, and you give all the options starting from an implant going to a cast partial, and followed by the gum stripper. As we also know, the commonest example is the normal removable partial denture, or RPD. So the patient chooses that. You know very well that the patient can easily afford it. So what will you do? The commonest thing colleagues do is कि जो मन में लड्डू फूट जाता है, which usually happens with all of us when we see a missing tooth, because we all know that crown and bridge or implant is the bread and butter of dentistry. Yes, the first reaction is कि हम कद्दू की तरह मुंह बना लेते हैं, and that is where we actually commit a wrong. Try to understand the logic behind a patient's mindset, who in spite of affordability is not willing for an expensive treatment, or at least the needful treatment. If not an implant, why not a bridge? So why is the patient not agreeing on it? Try to understand the mindset, go slightly deeper into the patient's psyche for that reason. And I always say the first consultation is a good time to go into that situation and go into that scenario. Try to understand whether it is a bad experience earlier which has happened before the patient came to you with another earlier dentist, or maybe a bad experience of a family member, or maybe a wrong opinion given by a colleague. What exactly is the reason? So your aim should be to clear that confusion, especially if the patient can actually afford it. You have to put in the myths, remove the or bust the myths of the patient regarding the mental security of having a RPD and not having a bridge or an implant. They have, many patients have inherent fears also, rather than the bad experience. So the second thing is, if they have the fears, you have to remove them as well. Somebody instilled in a fear that implant में तुम्हारे bone के अंदर सुराख करेंगे, हड्डी के अंदर, and that is sometimes which is fearful for the normal patient if you explain it in that way. When it comes to crown and bridge, तुम्हारे आसपास के दांतों को घिस घिस के इतू सा कर देंगे, छोटू सा कर देंगे, खाओगे कैसे? वो अपना लोड नहीं ले सकते, वो साथ वाले का क्या लेंगे? This is the misconception sometimes which is there. So try to understand the patient's mindset, go into the deeper root of the problem. What exactly is bothering the patient? Why is he not choosing it? It will only happen if you spend some time. If you are in a hurry and you are just say indulging in numbers to finish your OPD for the day, believe me, you are actually foregoing a lot of good work that can come your way through your talk. And as I always say, बात करने से ही बात बनती है. So unless you talk out with the patient, unless you know the deep rooted reason for that denial of treatment for the desired work or the needed work desired by you, need by the patient, if that is the reason, you need to really go into that aspect of the mentality of the patient. So don't just agree on the blindly on the removable partial denture or the RPD. Explain the patient about the obviously there are less of pros and more of cons in such a procedure. We all know that, especially when the wire goes on the adjoining teeth, and what kind of side effects it can cause. So please do explain that to the patient. But if after every explanation and say understanding, the patient still chooses, get a consent done and go in for the procedure, so that the patient does not blame you afterwards that yes, I was not given the option. And don't feel bad about it, because you tried your level best. But don't say a yes to RPD or a similar procedure where a higher end or a better procedure is possible, especially if it is in the good faith or in the goodwill or in the say much needed for the patient. So don't say an immediate yes. Spend some time, do your effort, and obviously your efforts will bear the fruit. So thank you so much for watching this video. I hope I'm able to put across my viewpoint regarding this problem, which we all commonly face when the patient chooses a lesser option. So please do spread the word. Please do tell your colleagues about the channel. This channel is exclusively for all my colleagues, doctors and dentists, and this is a part of my payback to the society. The channel is exclusively for all of you guys. So thank you so much for watching. Bye bye, take care. I shall be back soon with another video very shortly.